palpate for the radial pulse with your non-dominant hand. With the bevel of the needle turned upwards, insert the needle at an angle of 30 to 40 degrees to just under the skin surface. Continue gentle insertion until there is a flashback of blood into the hub of the needle. For the catheter over needle technique, insert the needle a further 2 millimeters and, with a twisting motion, advance the catheter over the needle into the artery. Apply pressure over the proximal artery with the fingers of your non-dominant hand while removing the needle. There should be a flashback of blood into the catheter. Attach the pressurized line to the catheter hub.